we can go ahead and get started.
Sure. Thank you, Mary Lee. And hi, everyone. Thank you all so much for joining us today for this refresher training. I am with my colleagues Dorothy Hersteiner and Elizabeth Pell. So we're just going to go over some of the basics today of the Adult Consumer Survey. I'm going to pull up an agenda here just so that you all have a sense of what we're going to cover. So basically, Dorothy's going to do a really quick overview of NCI, which we know you all are familiar with. We're going to go through the pre-survey background information of the Adult Consumer Survey. We'll look over Section 1 and Section 2. We won't go question by question, but we'll focus on some of the areas where we know interviewers have said they have a little bit more trouble. Then Elizabeth will go over some interviewing skills and best practices. We'll take a really quick look at our website and open it up for any questions. But as Mary Lee said, if you have questions as we're going through, please feel free to use that chat box. We'll try and get to your questions as much as possible. Anything that is outstanding, though, we'll be sure to get back to you all after the webinar if needed. One other note, we're going to be sending out a link to you all for just a brief SurveyMonkey of about 10 questions, just doing an evaluation of our refresher training. We want to make sure that we're making these as useful for you all as possible, so we will really appreciate hearing your feedback. So with that, I'm going to turn it over to Dorothy.
Hi everyone, my name is Dorothy and I work on the NCI project at HSRI. I'm just going to go over a brief synopsis of NCI because I know you all know what it is and how it works. It is a collaboration between HSRI and NASDs and the member state agencies. The collaboration began in 1997 in Washington, D.C. and 22 sub-state entities. NCI is a voluntary effort by these public developmental disabilities agencies to measure and track their performance. It is not a survey to measure how services and systems are working for individual people, but as a whole system. For example, NCI helps assess system performance by looking at, for example, whether people are satisfied with their services on a whole, whether the population being served feel respected by staff, served are engaging in activities in their community, etc. This is not a survey to assess individual satisfaction or system satisfaction. The goals of NCI are to establish a nationally recognized set of performance and outcomes indicators for DD service systems. As I said, states can use this information about system-level performance to make comparisons with other states and to benchmark their performance. For example, if they see in compared to other states, they're not doing as well on a certain indicator, they can use that number from one year and try to improve it for the next year. We've recently been given a grant from AIDD, the Administration on Intellectual and Developmental Disabilities, to expand NCI. This grant funds 5 states' participation each year for 5 years, with the goal to increase the NCI participation to include all 50 states. As it stands right now, so the goal is by the end of this grant to have a national sample to be able to look at system performance across the country. As you see here, this is our state participation as of right now. We're happy to have Vermont and Rhode Island joining us this year, and we have just a couple of holdouts. So some of the stuff that's happened in the past year, we've created an HCBS rules crosswalking the new rules with NCI. We're currently working on a new data brief on the data on rights and respect in the NCI survey. We've been revising our staff stability survey so that it measures indicators that states indicated to us were important to look at, such as staff pay, staff benefits, staff retention strategies. So that has been rolled out in a pilot project for the next 2 months, and then it'll be rolled out to all states starting in January, so that's very exciting. And we know that staff stability and staff satisfaction is tied to consumer outcomes, so it'll be exciting to look at those, to the consumer outcomes and the staff stability results in tandem. And next week is the AUPD conference, and we're excited to present there. So what is the Adult Consumer Survey? The format is a little weird. Sorry about the format of the slides. As you know, it is a conversation with adults receiving services, so we can assess their perspectives about the services they're receiving and their quality of life within the service system, such as employment, choice, relationships, case management, community inclusion, and health. And it's very important that the survey is done in a standardized way so that reliability can be ensured. There are no pre-screening procedures done, so you must attempt the survey with anyone who is within the sample. You can't just a priori say they cannot participate. It's only adults who are age 18 and over, and it takes approximately 45 to 50 minutes. There are 4 parts of the survey, which we're going to discuss in more detail. There's the pre-survey, which is information that is obtained before the interview. The background information, section 1, which is only with individuals receiving services and no proxy respondents, and section 2, which is, we prefer this, but assistance via proxy can be used in this section because these questions are not as subjective and they are more fact-based, like number of times out in the community, for example. I guess that's it. And now I'm going to pass it on to Steph, who's going to look over the pre-survey and background information.
All right, thank you, Dorothy. I am going to attempt to switch through to our consumer survey, so bear with me, please. All right, perfect. So the adult consumer survey. Yes, thank you. I was having some trouble finding it. So the adult consumer survey, I'm going to scroll right down to the pre-survey form. So the pre-survey information is information that gets collected before the meeting takes place. So it has some very standard information, things like the individual who is going to be interviewed, their name, their address, some basic things like that. It also has some information regarding other individuals who may be present during the meeting, and something such as accommodations that it would be important to know are necessary in order to set up the interview. What's really important to know is that this is not data that gets collected or analyzed at HSRI, so it's nothing that goes into reports. It's nothing that we capture. It's really just for the interviewers to be able to conduct the survey in the easiest manner possible. So not only do we have some information about the person themselves, but we ask things such as additional contacts who might be available, if the person may need somebody else with them during the interview for various reasons, things that are really important to know before heading into that meeting. Starting on pre-survey number 7, we ask questions about names of support staff, place of employment if there is one, a day program if there is one, if you will know that we have those little pre-survey bell symbols. And that means that as you're going through and asking questions to the individual, you can use names that are familiar to that person. So rather than ask if you have met your case manager, you can use the case manager's name, which may help the person better understand those questions. So jumping into the background information section, this is the part that we do start to analyze at HSRI. There are questions about some basic demographics of the individual. We also ask questions here about health and employment status. So these questions are really, really important. We understand that this can be a difficult part of the survey to complete. States use a number of different ways to complete this. They employ different methods, such as using case managers to complete the background information section, sometimes setting up sort of pre-meetings with staff or family who may know some of this information. As much as possible, we suggest collecting this at a time that is not at the time of the meeting. So the information is really dense, and a lot of it is kind of clinical questions, so it's not the greatest way to start off a meeting. So as much as possible, if this can be collected before the meeting takes place, it's a kind of best practices. This is also information that, if need be, can be collected after the meeting takes place. So if you find somebody who would be willing to talk to you after the meeting and fill in some of this information, that's perfectly acceptable as well. So we start off with that survey code, which is how we identify surveys when we do the data analysis. So the code that we use to go back to states if we have any questions about some of the individual data points as well. As you'll notice, we do have some of those questions highlighted, as we do every year. Those are the questions that are really important for risk adjustment. Essentially what that means is that we level the playing field for states. So we want to make sure that when we make comparisons statistically, that it's not because that there are not differences due to basic characteristics of the sample, but due to actual differences within the states. So we ask basic personal information, so the person's date of birth, gender, race, and ethnicity. I'm going to go through a couple of new questions that we added here in the background information section. So BI 10A is new this year. We ask now about what health conditions are noted in the person's record. And this is because we know a lot of you are really interested in looking at long-term health conditions, so things such as cardiovascular disease, diabetes, cancer. We know a number of states are looking at this compared to some of the information we collect around medication use and physical activity. So these data points are really important, not just to get a better sense of the people who are being served, but how that is connected with health equality and things like that. We ask about primary language and means of expression. Getting into some of the health questions, BI 14 we know is a difficult question to have answered in the most appropriate way. One thing just to remember here is that the overall health of this person, whether it's excellent, very good, fairly good, or poor, it really should be an overall snapshot of the person. So how has their health been over the past several months? It's not a point-in-time data. So we want to kind of be sure that you're mindful of that as you collect that information. BI 16 and the following several questions are about basic examinations and preventive health screenings. So one was the last annual exam, the last dental visit. You'll notice that most of these have response answers that go within several different year periods. So within the last year, the last 2 years, the last 3 and 5, or 5 or more. These questions also have a has never had a screening answer as well, which is important to mark off. We do collect information about the person's height and weight. We know, again, that this can be a sensitive question to ask people, and it can be kind of tricky. So we do want to collect this as much as possible. We don't want the person to feel uncomfortable if you're asking them directly, but we do use this information to report on BMI, which again is really important, looking at that in terms of medication use and physical activity. For those of you who are familiar with the Odessa system, you'll know that a number of these questions get graded out based on logic checks such as the person's gender or age. So when you're looking at BI 26, a female, one was the last TAP test. If you're meeting with somebody who is male, that gets marked not applicable automatically. The following question about the last mammogram, that gets marked not applicable if the person is male, but also if the person is under 40. So we want to make sure, so we're trying to kind of be sure that the data entry for you is as simple as possible. Thank you. Yes, and for those of you who do not know, who are not familiar with the Odessa, it is the online data entry system. Some of you will, most of you will be using that to enter the data. So starting with question BI 31, these are questions about medication. These ones, for those of you who are familiar with last year's survey, will notice that they changed a little bit. So this year, we're asking whether the person takes medication to treat mood disorder, anxiety, and psychotic disorder. We previously had these broken out for each type of disorder or condition, as well as behavioral challenges, and asked you to mark yes or no for each of those. We're now putting those 3, mood disorder, anxiety, and psychotic disorder, into one grouping as a yes-no response. We then ask how many medications, so not just whether the person is taking medications for any of those behaviors, but how many, so 1 to 2, 3 to 4, 5 to 10, 11 or more. Question BI 31 is similar to that previous one, but it's specific to medication taken for behavioral challenges. And then we have those follow-up questions if the person is taking medication. So how many medications? And then we also ask whether the person has a behavior plan. And that can be any plan, and is if the person has a plan when they're in school or at a day program, that's what we're looking for here. We're not being specific to the type or location of that plan. The next part of the background information is about residence type. For those of you who were at or listening in on the annual meeting, you know that we changed this slightly. So we broke out for people living in an ICF by beds, by number of beds. So we now ask for people living in an ICF with 1 to 3 residents, 4 to 6, 7 to 15, or 16 or more residents with disabilities. We also made sort of similar breakouts for group homes, so 1 to 3, 4 to 6, 7 to 15. And we also ask now a follow-up for people living in an ICF, especially or a group home, whether it's publicly or privately operated. The next part of the background information is the employment section. I won't go through all of these, but I will note that we do recognize that this is a really difficult grid to complete. It can take a lot of time getting the correct, appropriate answers here. When you go through and put in the number of hours worked or spent at a job, at an unpaid community activity, at a facility-based activity, whether it's paid or not. It doesn't have to be absolutely 100% the number of hours. We're looking for an approximation if that's what you can get. Same goes for the total wages. We want this to be as accurate as possible, but we do understand that it can be difficult sometimes pinning down the exact numbers. So if you have a close approximation and you're comfortable with that, we do want you to enter that information. Also, just to note that we are asking about a 2-week period. We're looking for the most typical 2-week period, though. So if the person typically works at a job but the last 2 weeks had taken a vacation, we don't want to discount that time taken for vacation. We want to look at what the most typical 2 weeks would look like. And then we just ask those questions that are pretty standard. They haven't changed very much. But basically some questions about whether the person is in school, what sort of programs pay for employment or day supports, and then some basic questions about the person if they're in community employment, so how long they've been working at their job, what type of job they have. The very last piece that I'll go over here is just those behavioral support needs. These again haven't changed, but are really important to collect this information. So we ask if the person needs support to manage self-interest, disruptive or destructive behavior. And for each of those, we have level of support needed. So none, some, or extensive support, or I don't know response as well. We do ask that very last question here for whose responsibility it is to collect the background information. This is just important for us to be able to look at by states who is collecting this information that can help us kind of better serve you all for training and data collection purposes. So with that, I'm going to turn it over to Dorothy to go into the section 1 of the consumer survey.
Just to note that we are looking at your questions, and we will address them towards the end of when we're going over the survey. So I'm going to start going over the section 1. Now this is where face-to-face conversation with the person receiving services begins. This section 1 may only be completed by directly speaking with the person receiving services and supports. That said, the individual may have support with him or her. For example, if he or she asks to have his or her case manager or staff there, that's fine, but make sure to let the individual know that questions will be asked about the case manager and staff. So if they feel comfortable, that's great. If not, you can judge the situation as you're going through it. Also, it is very important to make sure that the responses are coming only from the individual receiving services. So we'll begin. I'm going to go over some instructions here, but I want to look at this script that's right here. We recommend that you read this script. However, if you don't use the script, it's really important that you say some really important elements that are included in the script. For example, make sure to explain the purpose of the survey. Make sure to emphasize the point that it is not a test. Make sure to emphasize that if the individual does not understand a question, he or she will not get into trouble. He or she does not have to answer any questions. It's private, it's confidential, etc. So familiarize yourselves with the elements of this script. And then make sure you're comfortable with your state's consent requirements. And I'm going to talk a little bit about the interviewer's responsibility as a mandated reporter. If you see, excuse me, I just heard you're having trouble hearing me. If you see or hear about any sort of verbal, physical, emotional, or financial abuse, it is your responsibility to report this abuse to the appropriate authorities. That said, you have to emphasize to the individual that this survey is confidential. So if you do hear about a problem that doesn't fit that description as abuse, you can walk the individual through a process to solve the problem, such as give him or her a number to call, but you can refer to a familiar term or place in order to make the survey better understandable. So that's it. Here we go. So the question is, do you have a paid job in the community? It's important to understand what a paid job in the community is for the purposes of this survey. It's defined as at least 1 hour of work per week. This question is assuming a normal 2-hour work time frame. So all of the questions are referring to whether or not the person had a job within the community in the past 2 weeks. If the person, for example, goes to a day program and at the day program leaves, that is considered employment. So the response options here will tell if you're completing the survey in the Odessa system, the online data entry system. There'll be logic checks and the appropriate questions will be grayed out depending on the answer that you give. Regardless of what the background information section that was completed prior to the survey, to the face-to-face interview, says, it's important that we capture the individual's perception of whether or not he or she has a job. If a person says, no, I don't have a job, but you happen to know that he or she has a job, we recommend rewording the question or trying to get at what we're trying to answer here. Just rewording and trying to enhance understanding. If the person has more than one job in the community, the next couple of questions will refer to his or her primary job or the job that he or she likes best. So the next question is, if no, would you like to have a job in the community? Notice that there is an in-between response, and that's up to you whether or not you think there's some hesitance in there or not. Do you like working there? Again, there's an in-between response option there. And this is one of the questions where if you hear the person has said yes to all 3 questions, you might want to try to assess whether or not he or she is saying yes to appease you or whether or not these are the actual responses. The next question is, would you like to work somewhere else? And the italics provide a rewording of that question. Just to note that if the person says that he or she likes his or her job, he or she can also want to work somewhere else. That is an acceptable response. The next question about day program. A day program is defined as a regularly scheduled activity that is not community employment. It's about, we like to say it's probably 3 times a week. And it has some sort of schedule or routine. It's regular and structured. It's not necessarily, and it's not necessarily be going to a senior center or taking the class or going to a day program. Again, do you like going there and would you like to go somewhere else? And the next question is, do you do any volunteer work? And in this question, we do not want to include forced volunteering, which we define as when a day program takes all attendees to a soup kitchen or some other volunteering activity in which the individual is obliged to participate but may or may not want to. Next section is about home. Again, the question, do you like your home or where you live, can be a little anxiety provoking. We've had feedback that sometimes people think that if we're asking this question, it needs to move somewhere else. So make sure that you're sensitive to that, and you might want to reassure the person that that's not the case. Again, would you like to live somewhere else? It can be a yes response to questions 9 and 10. Do you ever talk with your neighbors? There are 2 yes responses. Make sure that you're aware of that. So the next question is, do people let you know before they come into your home? This question, if a person is living in a nursing home situation or an institutional situation, you can't always monitor who's coming into that room or into the home. And this question will be referring to people who come to the home specifically to see the individual, and basically means, are meetings or visits pre-planned? Is the person aware that that meetings are going to occur? The next question, do people let you know before coming into your bedroom? Do they knock? And do you have enough privacy at home? Clearly, privacy is kind of a difficult concept. We're not really getting at the need for supervision here. We're getting at whether or not the person can be alone if he or she wants, whether he or she feels as though he or she can do what he or she wants in their own space. Next section is safety. Are you ever afraid or scared when you're at home? This question is unique because the yes response is in brackets, and that means that the yes response is the less desired response, and this question can be used to assess whether or not the individual is responding yes to appease you as the interviewer, or whether or not he or she is understanding and comprehending the question. Question 16, are you afraid or scared? Go out in your neighborhood. Again, the question with the brackets to assess whether or not the individual understands afraid, because we're not speaking about, we want to know whether or not if the individual ever does feel afraid, there is someone he or she can speak to. Next, family and friends section. Do you have friends you like to talk to or do things with? This can include staff or family, and you'll notice that there is a response option for whether or not the individual has friends who are not staff or family, or whether all friends are staff or family. Do you have a best friend? Can you see your friends when you want to see them? This is, you'll notice that the sometimes response has a description. Sometimes the person can't see friends, for example, if there isn't enough staff or transportation. This question isn't getting at whether or not the friends are too busy or that the person is too busy. It's getting at access. Can you go on a date if you want to? Yes, there are 2 yes responses here, so be sure to be familiar with those. Do you ever feel lonely? We're not really getting at boredom. We've received some feedback that it's kind of a confusing concept. We're more getting at feeling alone. So if the person says yes here, again, the yes response is in brackets to make sure the person understands the question. But if the person says yes, make sure to remember that response, because further on in the survey, there's a question about additional services needed, and you might want to probe and see whether or not the person would like some services to help alleviate those feelings of loneliness. Again, family. Do you have family that you see? If the person lives with their family, we're not referring to the family that they live with, of course. Can you see family that when you want to? Again, we're not getting at whether or not the family is busy. It's about access. And can you help other people if you want to? This is a little difficult, a bit of a question that's difficult to get at. The point of the question is that all of the other questions in the survey are referring to help that the individual receives. And this kind of turns the tables and asks whether or not that person feels useful or productive and able to help their family members or friends or other people. So this is kind of about chores, picking up trash, things like that, and it's a subjective question. We're asking whether or not the individual feels that he or she can help other people. Now we're going to look at questions about satisfaction, service satisfaction. Did I skip a question? Sorry. Nope. Have you met your case manager or service coordinator? Different states use different terminology regarding case manager or service coordinator. Make sure that you use the more familiar term. Again, you'll see the bell symbol in the margin that refers to a question from the pre-survey. Do you have a service plan? That often people don't understand what that means. See if you can use some words, some rewording to try to clarify that concept. Did you help make your service plan? Next question, does your service coordinator, case manager ask what you want? For example, does the service coordinator or case manager ask if you want more transportation or accommodations? This question is getting at whether the service coordinator or case manager asks about things the individual wants as opposed to only things that he or she needs. The next question asks whether or not the case manager helps get what the individual needs if he or she asks for something. These are more getting at things that are needed for like health care or public benefits. If you call and leave a message, does your case manager or service coordinator take a long time to call you back, or does he or she call back right away? This is a little bit of a out-of-date question. We're getting at access to the service coordinator, so if the person typically emails, that still applies. Right away in this question is subjective, so if the case manager calls back within an hour, but that's too long for the individual, you would mark no, or it takes a long time to call back. It's because it's a subjective question. Next question, do you have staff who help you? No, this question was previously separated out by do you have staff at your home? And another question, do you have staff at your job? And another question, do you have staff at your day program? And we combined them into one question. The next question is, do your staff treat you with respect? And you'll notice that there is a yes, all staff, always, and sometimes or some staff. Be sure to be familiar with that differentiation. And often you'll need to probe a little bit to get at whether or not it's all staff always or some staff sometimes. Do your staff come when they are supposed to? If you have problems with your staff, do you get the help you want to fix those problems? This is about whether or not you have problems with the staff specifically, not whether or not the staff helps you solve problems. That can be a little confusing. Next question is about transportation. How do you usually get where you need to go? You can check all that apply here, but be aware that we're looking for the most frequent modes of transportation. And you can check all that apply. When you want to go somewhere, do you always have a way to get there? Now, with this question, we've noted that there's usually a very high percentage of yes responses. Yet states tell us that this is one of the biggest issues, that transportation, adequate transportation is one of the biggest barriers that individuals with intellectual developmental disabilities face in trying to achieve full inclusion in society. So we know that lack of transportation is a huge issue. Please, and we're trying to get more accurate responses to this question. So one of the things we ask is please try to emphasize that we're asking about places you want to go, not just places, we're asking about places the individual wants to go, not just where he or she needs to go. So we're very happy if the person definitely has a way to get to the doctor, but we also want to know if he or she can get to the cinema when he or she wants to go there. So please keep that in mind. The next section is only asked to people who are receiving self-directed services on a waiver and are on a self-directed waiver. So that will be clarified within the background information section, and you should know whether or not to proceed with the section with the individual you're interviewing. So make sure that you use the terminology that's most familiar within your state. Some states use self-direction and budgeting, individual budgets, etc. So, these questions: does someone talk to you about your budget and the services you can get? Is there someone who helps you decide how to use your budget or services? Can you make changes to your budget or services if you need to? Do you want more help deciding how to use your budget or services? Do you get information about how much money is left in your budget or services? And here's a suggested rewording with an indicator that there's some information in the pre-survey. And if yes, is the information easy to understand? And now we've reached the interviewer questions. In order for us to assess whether or not the responses to section 1 are valid, it's really important that these questions are answered. So please take the time to respond to these questions. We received a question prior to the interviewer training about whether or not, for example, if you're interviewing an individual and his or her parent or staff is sitting behind, so the individual can't see him or her, but the staff or parent is making clear that the responses are incorrect. It's important to try to reword the questions in a way that you're making sure that the individual receiving services is understanding them and you're getting accurate answers. But if you find that, I'm going to pass it over to Steph to give you a better answer to this question.
Sure. So the question is, if you know that or you feel that the person has been giving some valid responses, but a few of them, the parent or staff or whomever, are kind of shaking their head that the person is answering incorrectly. So you feel that a few of the questions may have not been answered appropriately. And this goes for Dorothy sort of alluded to. Sometimes we'll have that information from the pre-survey that maybe the person does or does not have a paid job in the community. Things like that. Maybe the person says they don't have a service plan and you know that they do. We don't want to automatically exclude all of section 1 because perhaps a couple of the answers were not completely accurate. So in that case, what we want to just have you do is kind of look at the overall, assess the overall section 1. Do you feel like by and large the person really did understand most of the questions and were giving valid answers? We want you to go ahead and accept that, even if you think there may be a couple of questions that were not answered as accurately as possible. If, however, you feel that by and large the person really was not understanding most of the questions, we wouldn't want you to do that, complete that section 1 or mark it as valid. One really important thing there too is that if you feel like the person is not understanding a couple of the questions in, say, the employment section, which can be a little bit tricky understanding what a paid community job is, it's okay to kind of skip those for the time being and move over to those home questions that are a little bit easier to understand. You might be able to get a kind of a little more subjective, basic questions about whether you like where you live, if you're feeling safe, things like that. And once a person sort of gets into the rhythm of answering the questions, you can try and circle back. And if you feel that they're still not understanding, it's okay to mark those few questions as don't know responses.